Hello, my name is Stephanie Davis Burnett, the Quality Improvement Supervisor at Viva Health, and I'm here today to discuss the use of masks and other facial coverings. Restaurants, businesses, and now state orders mandate the use of masks when in public. Now, most medical experts agree that masks should be worn by all when in public, unless medically contraindicated or in very small children. Did you know that 20 to 45% of coronavirus infected people don't have symptoms? Therefore, they are unknowingly spreading the infection to others when they are around you. Therefore, the most important practice that we can follow to prevent the spread of coronavirus, aside from social distancing and frequent hand washing, is to wear a mask or facial coverings. There are several different types or categories of facial masks or coverings out there, and we'll review a few. There is the medical type mask. It's usually paper thin, but it also has three very important filters sewn into it, which makes it very effective. There's also the N95 KN95 mask, which is the better type of mask because it has a snug, tight fit. In the hospital, the N95 mask actually is sized to accomplish a very appropriate tight fit for healthcare workers. And these are usually only necessary in the hospital setting. And then there are cloth masks. There are some that may be manufactured, such as this, or there may be one that you've homemade from some kind of material at your home, a bandana or cotton t-shirt, such as this one. Just be sure that it's double folded so that there's a double layer, which improves the effectiveness of it to not allow droplets through it. Any mask can be effective as long as it's worn on a regular basis. Even a single mask can reduce some droplets. One of the most fashionable or popular masks now is the OneWay Valve mask, the one with the little button. And one of the reasons is because they are easily breathable and they come in lots of different fashionable designs and colors. However, they are probably less effective than others simply by the mechanism in which they were made. The one-way valve was initially created for construction workers. The way that the one-way valve works is that it closes to prevent the wearer from breathing in dust and other toxic fumes, and then it opens so that the wearer can breathe out easily, hence passing droplets when doing that, which is not what you want to prevent the spread of coronavirus. So if you're wearing a one-way valve button type mask in public, you also need to make sure that you are using some kind of filters with it, or you need to wear another type of mask covering over it. So let's look at how to wear your mask effectively. You want to wash your hands with soap and water. That's always preferable, but the appropriate alcohol-based solution cleanser is also effective. So you want to wash your hands first before handling your mask. You want to grab your mask and then be sure that you're covering your chin, mouth, and nose. Apply the straps and then adjust your mask, ensuring the most appropriate, best fit that you can provide while you have it on. And once you place it, don't touch it. If by chance it slides off your nose and you need to readjust it, make sure you wash your hands. Don't let it hang under your chin or around your ears. Make sure it's appropriately placed, but avoid touching it once it's in place. And then you want to wash your hands. Now you've worn this mask all day long and it's time to take it off. The first thing you want to do, again, is to wash your hands. And then you want to handle your mask, avoiding touching the front of the mask, and handle it by the straps or ties and only around the edges. So you want to remove your mask. If it has not been heavily soiled, you may choose to reuse your mask, and you can do that by folding it inside, making sure the outside is on the outside and the clean part your face was on is on the inside. And then you can store it in a plastic bag such as this. And then make sure you always, after handling your mask, after it's been worn, to wash your hands again. You may, if you wear your mask and wearing it multiple times, wash your mask daily so that it's always clean. Wash your cloth mask. And your paper type masks, you need to throw those away. In order for us all to combat the spread of coronavirus, let's try to remember the 3 W's. Watch your distance, at least 6 feet from others. Wash your hands frequently. And wear your mask when in public. Thank you. Be safe.